Hello, and welcome to the California Community College Athletic Trainers Association COVID-19 educational session for administrators, faculty, and staff. In this presentation, we're going to go over COVID-19, prevention, mythbusters, treatment, responsibility to athletic teams, and fluidity. COVID-19 is an outbreak of unusual respiratory disease, initially dominated by pneumonia, in Wuhan, China, is caused by infection by a novel coronavirus. The new virus was initially named 2019 nCoV by the WHO. On February 11, 2020, WHO renamed the disease as Coronavirus Disease 2019, or COVID-19. Coronaviruses are a large family of viruses common in both people and animals. Most common coronavirus cause the common cold in humans. It is caused by a virus that has been named SARS-CoV-2, which is the same family of viruses as SARS and MERS. COVID-19 is a respiratory disease that is being spread by a new coronavirus that emerged in 2019. It affects both the upper and lower respiratory tract and is a virus, meaning that there's no medication or drug to cure COVID-19. Medication can only be used to treat symptoms. Speaking of those symptoms, some of these are more common signs and symptoms, but they are not the only ones that are present with illness, such as cough, fever, repeated shaking with chills, headaches, new or loss of taste and smell, severe vomiting, shortness of breath, chills, muscle pain, sore throat, loss of taste, or diarrhea. Watch for symptoms. People with COVID-19 have a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Other, less common symptoms have been reported, including gastrointestinal symptoms like nausea, vomiting, or diarrhea. Some of the complications from COVID-19 are acute respiratory failure, acute respiratory distress syndrome, viral pneumonia, acute kidney injury, acute liver injury, secondary viral and bacteria infection, septic shock, abnormal blood clots that can lead to pulmonary embolisms, or stroke. Okay, when to seek medical attention. You need to call 911 or call ahead to your local emergency facility, notifying the operator that are you seeking care for someone who has or may have COVID-19. Some of the emergency warning signs for COVID-19 is trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. This list is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning you. You need to call ahead to that local emergency facility to identify that you are coming in and to follow whatever policies and procedures that they may have in place. COVID-19 transmission. So, from person to person, between people who are in close contact with one another, respiratory droplets produced when an infected person coughs, sneezes, or talks, and droplets can land in the mouth or noses of people who are nearby or possibly been inhaled into the lungs. COVID-19 can be spread by individuals who are not showing any signs or symptoms. And then you can also contact by spread, by touching a surface or object that a virus is on, and then touching your own mouth, nose, or eyes. The amount of time that the virus can live on surfaces depends on the material of the surface. 72 hours on plastic and stainless steel, less than 4 hours on copper, and less than 24 hours on cardboard. So each surface that you touch or that could have been contaminated needs to be cleaned by a proper chemical that is identified in your packet. In order to prevent COVID-19, currently we are avoiding large events and mass gatherings. We are avoiding close contact, 6 feet, with sick individuals or social distance. Wash your hands with soap and warm water for 20 seconds, or use an alcohol-based hand sanitizer made with at least 60% alcohol. Avoid touching your mouth, eyes, and nose. Avoid sharing personal items like water bottles or towels. Clean and disinfect high-touch surface areas as needed. Tables, doorknobs, desk, and sport equipment. Used approved disinfectants. Avoid going to work, school gatherings if you are sick, and encourage student athletes to do the same. Another thing that you can do to prevent the spread of COVID-19 is do proper hand washing. This is the CDC's What You Need to Know About Hand Washing. Why should I use soap and water to wash my hands? Germs can get onto your hands and items you touch throughout the day. When your hands may be dirty, it is best to wash with soap and water to remove any articles on them. Either is fine as long as it is clean. Bar soap or liquid. Either is fine. Does the soap have to be antibacterial to work? No. Plain soap and water works just as well. What if I don't have soap but I have access to water? Using soap to wash hands is more effective than using water alone, but if water's all you have, rub your hands together under it and wipe off with a clean, dry towel. When hands are not visibly dirty, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. How long do I need to scrub in washing my hands? Scrubbing your hands for at least 20 seconds is most effective. Do I have to clean under my fingernails? Yes, germs like to hide under fingernails, making sure to clean there too. Towel or air dry. Either is fine, but if you're using a towel, make sure it is clean. Should I use a paper towel to turn off the faucet or open the door of a public bathroom? There isn't much scientific evidence about this. If you're concerned about getting germs on your hands after you wash them, you can use a paper towel to turn off the faucet and to open the door. What if I don't have soap or water to wash my hands? If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Alcohol-based hand sanitizers can quickly kill most types of germs on the hands, but may not kill a certain bacteria and viruses that cause diarrhea. Protect yourself and others by washing your hands with soap and water. Learn more about the magic of hand washing at the U.S. Department of Health and Human Services, CDC.gov/handwashing. Another thing you could do to prevent the spread of COVID-19 is to wear a face mask properly. In the picture on the right, it shows the correct way to wear a face mask, making sure both the mouth and nose are covered. Make sure that is fastened behind your earlobes and it is completely covering your nose and mouth. Do not touch the mask while using it, and if you do, please make sure you wash your hands. Remove the mask from behind your ears, holding the strings with your clean hands. Another thing to take into consideration is the differences between COVID-19 and flu or allergies. There are many similar signs and symptoms, but it is important to talk with your healthcare provider or athletic trainer on campus. Coronavirus has the following signs and symptoms: fever, cough, shortness of breath, or difficulty breathing, and symptoms can appear 2 to 14 days after the exposure. Flu, you also have a fever and cough, but with that it comes more so with muscle aches, fatigue and weakness, chills, sweats, congestion, and a sore throat. With allergies, you may be sneezing, have itchy nose or eyes or the roof of your mouth, runny or stuffy nose, and watery or red and swollen eyes. Another thing to take into consideration is some of our athletes do not eat or hydrate like they should. There are many times in which an athlete comes and might be having some of these signs and symptoms that are on the slide, and in fact it is due to either heat illness or lack of calories. So make sure you are abiding by and talking to your healthcare professional. Some mythbusters about COVID-19. There are currently no drugs licensed for treatment or prevention. Adding pepper to your soup or other meals does not prevent or cure COVID-19. It is not transmitted through houseflies or mosquitoes. Spraying and introducing bleach or other disinfectant into your body will not protect against COVID-19. Drinking methanol, ethanol, or bleach does not prevent or cure COVID-19. Cold weather and snow cannot kill the new coronavirus. High temperatures or humid environment does not prevent the spread of COVID-19. Drinking alcohol will not protect against COVID-19. Treatment. What if you get sick? You need to stay home except to get medical care. Most people have mild illness and can recover at home. Do not leave unless it is to seek medical care. Avoid public areas. Make sure you get rest and stay hydrated. Take over-the-counter medicines, for example, acetaminophen, to help with some of the symptoms. Stay in touch with your doctor or athletic trainer. Avoid public transportation. Make sure you separate yourself from other people within your house or apartment. And as much as possible, stay in a specific room and away from other people and pets in your home. If you must be around other people, make sure you are wearing a face covering. If possible, make sure to use a separate bathroom. Make sure to monitor your symptoms. Keep track of all your symptoms and be aware if they worsen. If your symptoms worsen or you believe you have an emergency warning sign, seek medical attention right away, such as troubled breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. And with this COVID-19 comes a new personal responsibility. Make sure you're communicating with medical staff prior to going to campus. Operating procedures will have changed, and make sure you talk to your institution about new policies or procedures that will be instilled in that institution. This will affect the availability, scheduling, and facility use. Understand your role and procedures in an emergency, and COVID-related. Make sure you have personal protective equipment. Your school should have acquired it. Know the location and appropriate use. Identify isolation area that you can take a person who feels that they are having some of the signs or symptoms. Prevention will only happen with your help. You may be required to perform new tasks and responsibilities. As a coach, administrator, or faculty member, you have a responsibility to your team. Educate them. Present accurate and up-to-date information to your athletes during the first orientation meeting and/or have them view online presentation. Go over prevention techniques and mandate that they be followed. Discuss responsibility that each student athlete has to each other, the athletic training staff, and the coaching staff, as well as your responsibility to them. Provide your team a safe environment to train and compete. What can be changed about meetings and film viewing? Do we now do that virtual instead of getting everybody in the same room? Training and conditioning. Maybe now we have smaller groups or just specific position groups in the weight room and scheduled time accordingly. Practice time and activity drills. Are the facilities and venues being maintained and disinfected according to new standards? Make sure you know what chemicals are being used on any type of shared equipment and that it is going according to directions. Some of the chemicals require the chemical to sit on for as long as 10 to 15 minutes. Are we allowing enough time in between the scheduling to permit the proper use of the chemicals to take place? Any shared equipment needs to be cleaned appropriately. Another responsibility to your team is communication. Make sure you're communicating with an athletic trainer about signs or symptoms prior to getting on campus. Make sure you're following the institution policies. Hopefully, your institution has instilled a policy in that nobody goes to campus that are having any signs or symptoms, and we're not risking getting others infected. Encourage and enforce the stay home standards for student athletes and staff when experiencing any symptoms. Foster an open and honest environment that doesn't put down student athletes for staying home. And mental health. Be a resource for your student athletes' mental well-being. In case of an emergency, your role and responsibility, make sure that the emergency action plans are updated and there is a specific plan regarding COVID precautions. Use protective personal equipment at onset of activating the emergency action plan. What to do if your student athlete gets sick. Be honest, be timely, isolate per the institution policy at each venue. It is also important to note that since COVID-19 is a very fluid illness and pandemic, that we are getting new research and education ability throughout. Remember, COVID-19 is an illness caused by a novel coronavirus. New information is constantly emerging, and that guidelines are continuously changing. Because of that, education will be ongoing. To stay up to date, you can visit the Center for Disease Control website, cdc.gov, or the World Health Organization website, who.int. Some other resources to consider are the CDC Infection Prevention and Control Assessment Tool for outpatient settings, the Board of Certification Facility Principles, the CDC Guideline for Isolation Precautions, Prevention, Transmission of Infectious Agents in Healthcare Settings, the NC2A Core Principles of Resocialization of Sport, the American College Health Association COVID-19 Resources, and the ACHA Guidelines, Student Health Considerations and Guidelines for Reopening Higher Education and Institutions. Some more resources are the EPA list of disinfectants for use against SARS-CoV 2020, CDC guidance for selection and use of personal protective equipment in healthcare settings, inter-association recommendations in preventing catastrophic injury and death, the joint consensus guidelines for transition periods, and then your websites for local, county, or regional board of health governing bodies that are responsible for administrating and enforcing state public health laws and regulations. This PowerPoint we utilized these several references. And last but not least, these. Please make sure you're adhering to state, local, and county guidelines as well as your institution guidelines. If you have any questions or concerns, feel free to reach out to the CCCATA in concerns with your student athlete and healthcare and COVID-19. Thank you and have a good day.